My insurance denied a claim for a procedure I never had. When I called to dispute it, they sent me the surgical photos. That's my body on that table. I don't remember any of it. I work in accounts receivable for a mid-sized logistics company in Cleveland. It's boring work, the kind where you check spreadsheets until your eyes blur and you forget what day it is. I'm good at it, though. Detail-oriented, my manager says. I catch the mistakes other people miss. So when I got the explanation of benefits letter from my insurance company on a Tuesday in March, I noticed right away that something was wrong. The envelope was thin, which usually means a denial. I opened it standing in my kitchen, still wearing my jacket, my keys in my other hand. I'd stopped by the mailbox on my way up to my apartment like I always do. The letter was dated 3 days earlier. Standard format, the kind I'd seen a dozen times before for regular stuff. Annual checkup, dental cleaning, that time I had strep throat. But the amount made me look twice. $32,417. Denied due to lack of prior. I read it again. Then a third time. The procedure code listed was CPT 99223. I didn't know what that meant, but the description was right there in plain English. Laparoscopic bilateral salpingo-oophorectomy with lymph node dissection. I had to Google it. Removal of both ovaries and fallopian tubes, plus lymph nodes. My hand went to my stomach, an automatic gesture. I felt fine. I felt normal. I hadn't had surgery. I definitely hadn't had my ovaries removed. That's not something you forget. The date of service was listed as February 14th, Valentine's Day. I'd worked that day. I remembered because Jenkins had brought in those terrible conversation heart candies and left them in the break room. I'd eaten lunch at my desk. Same as always. Leftover chicken stir-fry. I'd gone home, watched 3 episodes of that baking show I like, and gone to bed early because I had a meeting the next morning. I hadn't been in a hospital. I hadn't been under anesthesia. I called the insurance company. Their customer service line had a 20-minute wait time, so I put it on speaker and made myself a cup of tea while I waited. The hold music was that generic instrumental stuff that sounds like it's being played underwater. When someone finally picked up, I explained the situation to a woman named Jennifer, who sounded like she was reading from a script. I'm showing here that the claim was submitted by Dr. Richard Kowalski at Cleveland Surgical Associates, she said. The procedure was performed at their outpatient facility on February 14th of this year. I wasn't there, I said. I didn't have surgery. This has to be a mistake. Maybe someone else's claim got attached to my account? Let me verify your information, Jennifer said. Can you confirm your date of birth? I gave it to her. July 9th, 1987. And your member ID number? I read it off the letter. That's all correct, she said. The claim is definitely filed under your account. But I didn't have the procedure, I said again. I was trying to stay calm, but my voice was getting tighter. I need this corrected. This is obviously fraud or identity theft or something. I understand your concern, Jennifer said in that practiced customer service voice. What I can do is submit a dispute on your behalf. You'll need to complete a fraud affidavit, and we'll investigate the claim. That process typically takes 30 to 60 days. 30 to 60 days? What am I supposed to do in the meantime? The claim has already been denied, so you're not responsible for payment at this time, she said. But the provider may attempt to bill you directly. If they do, don't pay anything until the investigation is complete. She emailed me the fraud affidavit. I filled it out that night, sitting at my kitchen table with my laptop, checking the boxes that confirmed I had not received the services billed, had not. It felt surreal, like I was filling out paperwork to prove I existed or didn't exist. I wasn't sure which. I mailed the affidavit the next day, then I called Cleveland Surgical Associates. The receptionist who answered was friendly, professional. I explained that there was a billing error, that I'd never been a patient there. "Let me pull up your file," she said. I heard keyboard clicking. "Can you spell your last name for me?" I did. More clicking. "Okay, I'm showing an appointment on February 14th. You were scheduled for 1 p.m. "I wasn't there," I said. "Our records show you checked in at 12:45, she said. Her voice had shifted slightly, less friendly now, more cautious. "You were taken back to pre-op at 1:15. That's impossible. I was at work that day." "Ma'am, I'm looking at your intake forms right here. You signed the consent paperwork, the HIPAA release, the anesthesia acknowledgement." "I didn't sign anything," I said. My heart was beating too fast. "I've never been to your facility. Can you check the signature? It's not going to match." There was a pause. "I can have our billing department contact you," she said finally, "but our records are very clear. You were a patient here." "Then your records are wrong." I hung up before she could respond. That night I couldn't sleep. I kept thinking about the date. February 14th. I'd worked that day. I remembered it. But the more I tried to remember specific details, the fuzzier it got. What had I done at lunch? Had I really eaten at my desk? Or had I gone out? No, I definitely stayed in. I remembered the stir fry. I'd made it the night before, Sunday the 13th. I remembered cooking it because I'd burned the vegetables slightly and had to scrape the bottom of the pan. I got up and checked my work calendar on my phone. February 14th was a Friday. I'd had the morning meeting. That was definitely real. I'd presented the quarterly reconciliation report, but the afternoon was blank. No meetings scheduled. I checked my email. Nothing sent or received between noon and 5 p.m. that day. That was weird. I usually sent dozens of emails a day. I checked my text messages. Nothing on the 14th until 7:30 p.m., when I texted my mom back about dinner plans for the following week. Where had I been that afternoon? I pulled up my bank statement on my laptop. Sometimes I bought lunch out, used my debit card, but there were no charges on February 14th. Nothing at all. My hands were shaking. I closed the laptop. This was stupid. I was letting this get to me. Obviously, there was a simple explanation. Identity theft happened all the time. Someone had stolen my insurance information and used it to get a procedure done. The surgical center's records were falsified. It was fraud, plain and simple. But the receptionist had sounded so certain. I went back to bed, but I didn't sleep much. I kept touching my stomach, feeling for scars that weren't there. The photos arrived on Thursday. I came home from work to find a large manila envelope in my mailbox, the kind with the bubble wrap lining. No return address, just my name and apartment number printed on a label. I opened it in my kitchen. Inside were 8x10 color photographs. Medical photographs. Surgical photographs. The first one showed an operating room. Standard setup. Bright lights. Blue surgical drapes. Stainless steel instruments on a tray. A body on the table, prepped and draped. Only the surgical site visible. The second photo was closer, an incision, small and neat. Laparoscopic, I realized. That's what the L in the procedure code meant. The third photo showed the inside of a body cavity. I'm not squeamish. I'd watched plenty of medical shows. But seeing it in a photograph, knowing it was supposed to be from a surgery I'd had, made my stomach turn. The fourth photo showed tissue being removed. Dark red, glistening. An ovary, I assumed. Though I wouldn't have known what one looked like if I hadn't Googled it after getting the insurance letter. There were 4 more photos. Different angles, different stages of the procedure. Professional quality. The kind taken for medical records. And in the last photo, just barely visible at the edge of the frame, was a wristband, a patient identification wristband. I could make out partial letters, my last name, the first 3 digits of a date that could have been February 14th. I dropped the photos on the counter like they'd burned me. My phone rang. Unknown number. I almost didn't answer, but something made me pick up. Ms. Garrett? A man's voice, professional. This is Dr. Richard Kowalski from Cleveland Surgical Associates. I understand you've been disputing your recent procedure. I didn't have a procedure, I said. My voice sounded strange, too high. I'm looking at your file right now, he said. I performed the surgery myself. You came in for a consultation on January 23rd. We discussed the bilateral salpingo oophorectomy, the risks and benefits, the recovery timeline. You scheduled the procedure for February 14th. I've never met you, I said. You were nervous, he continued, like I hadn't spoken. You asked about the scarring, whether it would be visible. I assured you that laparoscopic incisions are very small, usually fade significantly within 6 months. Stop, I said. You tolerated the anesthesia well. No complications during the procedure. Your post-op vitals were stable. You were discharged at 4:30 p.m. with prescriptions for pain management and antibiotics. I said stop. We scheduled a follow-up for 2 weeks later, but you didn't show up for that appointment. We called several times, left messages, you never called back. I hung up. My hands were shaking so badly, I could barely hold the phone. I looked at the photos spread across my counter. That wristband, those incisions. I pulled up my shirt and looked at my stomach in the harsh kitchen light. Nothing. No scars. No marks. My skin was pale and unmarked, the same as it had always been. I called my primary care physician. Reeves had been my doctor for 5 years. If I'd had surgery, she would know about it. There would be records, referrals, follow-up care. Her office was closed for the day, but I left a message with the answering service. Emergency callback requested. Then I called my mom. Honey, what's wrong? She said immediately. You sound upset. Did I tell you I was having surgery in February? What? No. What kind of surgery? You're sure? I didn't mention anything about a procedure or going to a surgical center. Emma, you're scaring me. What's going on? I told her everything. The insurance claim, the photos, the doctor who insisted he'd operated on me. That's insane, she said. You need to call the police. This is identity theft. But the photos, they're fake. They have to be. You said yourself you don't have any scars. She was right. Of course she was right. But I couldn't stop looking at that wristband. Reeves called me back within an hour. I explained the situation and she pulled up my records while I waited on the line. I don't have any referrals to a surgeon in your file, she said. And you definitely didn't mention anything about this at your annual physical in January. When was that, the 16th? January 16th, yeah, I said. Right. We did your standard blood work, pap smear, breast exam. Everything was normal. I would have. So I didn't say anything about it? Not a word. Emma, have you reported this to the police? I hadn't. I called them after I hung up with Dr. Reeves. The officer who took my report sounded bored. Medical identity theft, he said, was becoming more common. Criminal rings would steal insurance information and bill for procedures that never happened. Sometimes they'd create fake documentation to support the claims. But they sent me photos, I said. Stock photos probably, he said, or photos from actual surgeries with identifying information edited in. We see it all the time. He took down all the information and gave me a case number. He said someone from the fraud division would follow up within a week. I felt better after that. A little. It made sense. It was fraud, sophisticated fraud. But fraud nonetheless. Except I still couldn't remember that afternoon. February 14th, between noon and 5 p.m., 5 hours, just gone. I'd been at work, I had to have been. But I couldn't remember. I started keeping, then lunch, the stir-fry at my desk, right? Or had I gone out? The more I tried to remember, the less certain I became. I called my coworker, Diane, who sat 2 cubicles down from me. Do you remember February 14th? I asked her. It was a Friday, about 3 weeks ago. That's pretty specific, she said. Why? I'm trying to remember if I was in the office that afternoon. I think so. I mean, I don't specifically remember, but I'm pretty sure you were around. Why? Did we have lunch together? I don't think so. I usually eat at my desk on Fridays because I leave early. Why are you asking? Just trying to remember something, I said. I hung up feeling worse, not better. That weekend, I went through my apartment looking for anything that might help me remember. Receipts, I found the prescription bottles in my bathroom cabinet. 2 of them tucked behind my regular medications. Both from Cleveland Surgical Associates Pharmacy. Both filled on February 14th. Oxycodone, cephalexin, pain medication, and antibiotics. Both bottles were half empty. I stood there in my bathroom, staring at the bottles in my hand. I didn't remember taking these. I didn't remember picking them up from a pharmacy. I didn't remember anything. I Googled the medications. Standard post-surgical prescriptions. The dosing schedule on the labels indicated I should have taken them for 7 days following the procedure. I counted the pills. The numbers matched. I'd taken them exactly as prescribed, but I didn't remember. I sat down on my bathroom floor, the pill bottles still in my hands, and tried very hard not to panic. My phone buzzed. Email notification. It was from my insurance company. Subject line, claim update action required. I opened it. We have completed our initial review of your fraud affidavit regarding claim number 7749213. However, we have received additional documentation from the provider that supports the validity of the claim. Please review the attached materials and contact us within 10 business days if you wish to continue disputing this claim. There were 3 attachments. The first was a consent form, my signature at the bottom, clear as day, dated January 23rd. The form outlined the procedure, the risks, the expected outcomes, everything. The second was an intake questionnaire, my handwriting. I recognized it immediately, the way I made my lowercase a's, the slight leftward slant. answering questions about my medical history, current medications, allergies. The third was a photograph. Me in a hospital gown, sitting on an exam table, smiling slightly, looking directly at the camera. The date stamp in the corner read February 14th, 12:51 p.m. I was looking at myself in a place I'd never been, at a time I couldn't remember. I stopped going to work. I called in sick on Monday, then again on Tuesday. By Wednesday, I just stopped answering when my manager called. I couldn't focus on spreadsheets and reconciliation reports when I was losing my mind. I'd spread everything out on my living room floor. The insurance letters, the surgical photos, the prescription bottles, the consent forms. I'd printed out my bank statements, my work calendar, my email logs. I was looking for gaps, inconsistencies, proof that this wasn't real. But everything lined up. The prescriptions had been filled at a CVS 3 blocks from Cleveland Surgical Associates. I checked my bank statement. There was a charge for $37.42 on February 14th at 5:03 p.m. Copay for 2 prescriptions. I'd been there. I'd picked them up. I called the CVS. The pharmacist checked the records. "Yes, you picked these up yourself," she said. "I remember because you asked about the interaction between the oxycodone and ibuprofen. I told you to space them out by at least 2 hours." "What did I look like?" I asked. "I'm sorry?" "When I picked them up, what was I wearing? Did I seem okay?" There was a pause. "Ma'am, I fill hundreds of prescriptions a day. I don't remember specific details like that." But she remembered the interaction question. She remembered me. I drove to Cleveland Surgical Associates. The building was nice, modern, glass and steel, with a small parking lot in front. I sat in my car for 20 minutes, just looking at it. I'd been here. According to everyone, I'd been here. Finally, I went inside. The receptionist looked up when I walked in. "Can I help you?" "I'm Emma Garrett," I said. "I had a procedure here on February 14th. Her expression changed. Recognition. "Oh, Miss Garrett, are you here for your follow-up? You missed your last appointment." "I need to see my file," I said. "I can make you a copy, but you'll need to fill out a release form. I need to see it now." She looked uncertain. "Let me get the office manager." The office manager was a woman in her 50s, professional and calm. She brought me to a small conference room and returned a few minutes later with a file folder. "This is everything we have on you," she said, setting it on the table. "You're welcome to review it here." I opened the folder. Intake forms, my handwriting, my signature, consultation, my reasons for requesting it. I read that section 3 times. According to I didn't have chronic pelvic pain. My mother was alive and healthy. No history of cancer. My grandmother had died of a stroke at 83. But none of it was true. But it was written down, documented. There were more pages. Pre-op instructions, post-op care guidelines, a prescription for hormone replacement therapy, which I had apparently declined. And then, near the back of the file, I found something else. A different consent form, not for the surgery itself, but for something else. Consent for participation in medical research study. I read it carefully. The study was being conducted by the Department of Anesthesiology at Case Western Reserve University. They were researching the effects of a new anesthetic protocol on memory consolidation and post-operative recall. Participants would undergo their scheduled surgical procedures using the experimental protocol. They would be monitored for adverse effects. They would complete follow-up questionnaires about their memory, the perioperative period. Compensation, $500 paid upon completion of the 6-month follow-up. I'd signed it. My signature was right there at the bottom of page 7. Page 7. Who reads to page 7 of a consent form? My hands were shaking. I pulled out my phone and took pictures of every page in the file. "Are you all right?" the office manager asked. She'd been standing in the doorway watching me. "This research study," I said, pointing to the form. "Who do I contact about it?" She looked at the page. "Oh, that. Yes, Dr. Kowalski participates in several research protocols. There should be a contact number at the bottom." There was. I wrote it down. "Ms. Garrett," she said carefully, "I understand you've been disputing your claim, but everything in this file is legitimate. You were a patient here. The procedure was performed. You received appropriate care." "I don't remember any of it," I said. "That's not uncommon with anesthesia," she said. "Some people have very little memory of the day of surgery. It's normal." "This isn't normal," I said. I left before she could respond. I called the research study number from my car. It rang 4 times before going to voicemail. A recorded message gave me an email address and said someone would respond within 48 hours. I didn't have 48 hours. I was unraveling. I drove home and went through the file photos again on my laptop, zooming in on every detail. The consent form for the research study was dated January 23rd, the same day as my consultation. I'd signed it along with all the other paperwork, buried in the middle of a stack of documents, easy to miss. The study protocol was described in dense medical language, but the core was clear. They were testing whether a specific combination of anesthetic agents could be used to prevent traumatic memory formation in surgical patients. The idea was that patients undergoing painful or frightening procedures might benefit from not remembering the experience, but that wasn't all. I found another section deeper in the protocol description, a subsection about extended perioperative amnesia and temporal dissociation effects. The drug combination they were testing didn't just prevent memory formation during surgery, it prevented memory formation for hours before and after. The consent form acknowledged this as a known side effect. Participants might experience retrograde amnesia extending up to 6 hours prior to anesthesia administration, and anterograde amnesia extending up to 12 hours post-procedure. 6 hours before, 12 hours after. I checked the timestamps on my surgical photos. Anesthesia administered at 1:23 p.m. on February 14th. 6 hours before that would be 7:23 a.m. I would have lost everything from 7:23 a.m. until when? 1 a.m. the next morning. Almost 18 hours. I sat back in my chair, my heart pounding. I'd been at work that morning. I remembered the meeting. That was at 9 a.m. Well after 7:23. But did I really remember it? Or did I just remember that I should have been there, that it was on my calendar? I pulled up my work email again, the quarterly report I'd supposedly presented. I searched for the file. It was there, sent to the meeting attendees at 8:47 a.m. on February 14th. but I always presented from my laptop, using the projector in the conference room. I wouldn't have sent the file in advance, unless I hadn't been there to present it. I called Diane again. Did I present at the quarterly meeting on February 14th? I asked without preamble. Jesus, Emma, you're obsessed with that day. Are you okay? Just answer the question, please, she sighed. I don't know. I wasn't in that meeting. I think Jenkins mentioned you'd sent the report by email because you had a doctor's appointment or something. A doctor's appointment. Did I tell him that? I guess. I don't know, Emma. I'm worried about you. I hung up. I hadn't been at the meeting. I'd sent the report by email because I had a doctor's appointment, a surgical appointment. I checked my sent email folder again, looking more carefully this time. There it was, sent at 7:51 a.m. on February 14th to my manager. Hi, Tom. I have a medical appointment this morning and won't be able to present in person at the 9 a.m. meeting. I've sent the quarterly report to everyone. Let me know if you have any questions. Thanks, Emma. I'd written that email while I was already under the effects of the pre-surgical amnesia protocol. I'd gone to work that morning, sent the email, and then driven to the surgical center, checked in, filled out paperwork, all while the drugs were already in my system, preventing me from forming memories. I searched my apartment for more evidence. I found my work bag, the one I carried every day. Inside was a parking receipt. Cleveland Surgical Associates. Validated parking. February 14th, 12:32 p.m. I'd parked there. I'd had the ticket validated. I had no memory of it. My phone rang, the number from the research study. Ms. Garrett? A woman's voice, professional. This is Dr. Sarah Chen from the Case Western Anesthesiology Research Team. I understand you have questions about the study you participated in. I don't remember participating, I said. Yes, that's consistent with the study protocol, she said calmly. The amnesia effects are quite comprehensive. That's actually what we're studying. The potential therapeutic applications of controlled memory suppression in surgical contexts. You erased my memory. We suppressed memory formation during a specific time window, she corrected. You consented to this. It's all explained in the study documentation. On page 7 of a form I signed while I was already on your drugs, I said. There was a pause. The consent process was completed during your initial consultation on January 23rd, she said. You weren't given any study medications until the day of your procedure. Then why don't I remember the consultation? Another pause, longer this time. Ms. Garrett, have you been experiencing any unusual symptoms? Confusion, disorientation, gaps in memory beyond the expected perioperative period? I don't remember 3 weeks of my life, I said. 3 weeks? That's not possible. The protocol only affects memory formation for approximately 18 hours maximum. Then explain this, I said. I pulled up my bank statement on my laptop. I have prescription charges on February 14th, 21st, and 28th. 3 separate pharmacy visits. I don't remember any of them. You were refilling your pain medication, she said. That's normal post-operative. I had the prescriptions refilled twice for a laparoscopic procedure. Silence. Dr. Chen, I said slowly, how many procedures have I had? How many procedures? I asked again. She hung up. I pulled up my insurance claims portal online. I'd only looked at the most recent denial before. the one that had started all this. Now I scrolled back. February 14th, bilateral salpingo oophorectomy, denied. February 21st, laparoscopic liver biopsy with tissue collection, denied. February 28th, bone marrow aspiration and biopsy, denied. March 7th, lymph node excision, denied. March 14th, renal tissue collection, denied. 5 procedures, 5 Fridays in a row, all denied for lack of prior, all performed by Dr. Richard Kowalski at Cleveland Surgical Associates. I couldn't breathe. The room was spinning. I grabbed my phone and pulled up my photos, looking for the surgical pictures they'd sent me. I'd only looked at them briefly before, too disturbed to examine them closely. Now I looked at every detail. Different procedures, different surgical sites, but the same wristband visible in each one, the same patient ID, the same body, my body. I ran to the bathroom and pulled up my shirt, looking at myself in the mirror. Nothing. No scars, no marks. But laparoscopic incisions were small, easy to miss. I looked closer, running my hands over my abdomen, my sides. There, just below my rib cage on the right side. A tiny mark, maybe 3 millimeters long. It could have been anything. A scratch, an old pimple scar, or an incision. I found 2 more. One near my navel, one on my left side, just above my hip. Small, professional. I looked at my arms, the inside of my elbows, where they draw blood. Faint bruising, yellowish green, almost faded. My hip, where they do a bone marrow biopsy. I pressed on it. Tender, deep ache. Oh God, it was real. All of it was real. I'd had 5 surgeries in 5 weeks, and I couldn't remember any of them. I pulled up the consent form again, the one from the research study. Read it more carefully this time. The study wasn't just about preventing traumatic memories during surgery. It was about something else. There was a section I'd missed before, buried in the medical terminology. Participants will undergo a series of minimally invasive tissue collection procedures over a 6-week period. The experimental anesthetic protocol will be administered prior to each procedure to assess the consistency and reliability of memory suppression across multiple interventions. Tissue collection, not treatment. Not surgery to fix something wrong, collection. They were taking pieces of me. I scrolled down to the compensation section again. $500 upon completion of the 6-month follow-up. But there was more text below that, in smaller font. Additional compensation may be provided for tissue samples suitable for research use, at rates determined by sample type and quality. Participants will be notified of sample acceptance and compensation amounts via the study portal. I didn't have access to any study portal. I didn't know there was one. I searched my email for anything from Case Western, from Dr. Chen, from the research study. Nothing. I checked my spam folder. There. 17 emails, all from an automated system. Tissue sample processing update. Dates ranging from February 15th through March 21st. I'd never opened them. They'd gone straight to spam. I opened the most recent one. Sample ID 7749213-05 has been processed and approved for research use. Compensation amount, $875. Total study compensation to date, $3,922. Payment will be processed to your designated account upon completion of the study protocol. $3,922 for pieces of my body. I checked my bank account. No deposits, nothing from Case Western or any research foundation. But there was a new account listed under my profile. A savings account I didn't remember opening. Balance, $3,922. I clicked on the transaction history. 5 deposits, matching the dates of the procedures. Different amounts for each one. The smallest was for the lymph node, $412. The largest was for the bone marrow, $1,150. I was being paid for my organs, piece by piece, and I couldn't remember agreeing to any of it. I called Dr. Kowalski's office again. The receptionist tried to transfer me to voicemail, but I wouldn't let her. "I need to speak to him now," I said. "Tell him it's about the study. Tell him I remember." That got her attention. She put me on hold. Kowalski picked up within 30 seconds. "Ms. Garrett," he said. His voice was different than before. Careful. "I understand you're upset. You've been harvesting my organs," I said. "That's not accurate," he said. "We've been collecting tissue samples for research purposes with your full consent. Everything has been done according to the study protocol." "I don't remember consenting." "That's the nature of the study," he said. "The memory suppression protocol is designed to prevent traumatic recall. It's working exactly as intended." "You're supposed to tell people what you're doing to them." "We did. It's all in the consent form. You signed it. On page 7. The page number is irrelevant. You were given time to read the entire document. You asked questions. We answered them. You signed voluntarily. I was shaking so hard I could barely hold the phone. "What else are you planning to take?" I asked. Silence. "Dr. Kowalski, what else?" "The study protocol includes 6 procedures total," he said finally. "You've completed 5. The final procedure is scheduled for this Friday, March 21st. "I'm not coming," I said. "You signed a contract," he said. "If you withdraw from the study before completion, you'll be required to return all compensation received to date, plus a penalty fee for breach of contract. That's in the terms you agreed to." "I don't care about the money." "The penalty fee is $15,000, he said, plus the $3,922 in compensation. That's almost $19,000, Ms. Garrett. Do you have that available?" I didn't. I had maybe $2,000 in my checking account. "The final procedure is minor," he continued. "Skin biopsy and adipose tissue collection. Outpatient, minimal discomfort, quick recovery. You'll be in and out in 2 hours. And then you're done. Full compensation. No penalties, no further obligations." "What are you doing with the samples?" I asked. "That's proprietary research information. But I can tell you that your tissue has been extremely valuable. High quality, excellent cellular viability. You should be proud of your contribution to medical science." "I want out," I said. "Then you'll owe us $18,922 by end of business Friday," he said. "Otherwise, we'll see you at 1 p.m. for your final procedure." He hung up. I sat there with my phone in my hand, trying to process what had just happened. They owned me. They'd found a legal way to own me. I'd signed a contract, buried in medical jargon and fine print, that gave them the right to take pieces of my body. And the memory suppression protocol ensured I wouldn't remember agreeing to it. wouldn't remember the procedures, wouldn't be able to back out without financial ruin. It was perfect, completely legal, completely horrifying. I thought about going to the police again. But what would I tell them? I'd signed consent forms. I'd been paid. Everything was documented. I thought about getting a lawyer. But I didn't have money for that. Especially not if I owed Cleveland Surgical Associates $19,000. I thought about just not showing up on Friday, let them sue me, declare bankruptcy if I had to, but then I thought about the tissue samples, my ovaries, my bone marrow, my liver tissue, sitting in some lab somewhere being used for research I knew nothing about. Pieces of me scattered across the country, maybe across the world, and I couldn't get them back. Friday came. I drove to Cleveland Surgical Associates at 12:30, parked in the lot, sat in my car. I could leave. I could drive away and deal with the consequences. But I wanted to remember this time. I wanted to know what they were doing to me. I went inside. The receptionist smiled when she saw me. "Ms. Garrett, right on time. Just need you to sign in." I signed. She handed me a clipboard with forms. Just the standard pre-op paperwork. You know the drill. I looked at the forms. Consent for anesthesia, consent for the procedure, consent for tissue collection, and at the bottom, a checkbox. I agree to participate in the memory suppression protocol as outlined in the research study consent form. I didn't check the box. The receptionist noticed. "Oh, you need to check that one. It's required for study participants." "What if I don't?" I asked. She looked confused. "Then I guess you'd have to withdraw from the study? But Dr. Kowalski said you were completing the final procedure today." "I want to remember this one," I said. "That's not how the study works," she said. "The whole point is the memory suppression. If you don't use the protocol, you're not completing the study requirements. So I'd still owe the penalty fee?" "I think so. You'd have to ask Dr. Kowalski." He appeared in the doorway as if summoned. "Ms. Garrett, is there a problem?" "I want to remember this procedure," I said. "That's not part of the protocol." "Then I'm withdrawing from the study." He looked at me for a long moment. "You understand the financial implications?" "Yes." "And you're prepared to pay the full amount owed?" "No," I said, "but I'm not letting you erase my memory again." He smiled. It wasn't a nice smile. "That's fine," he said. "We can proceed with standard anesthesia. You'll remember everything. The incisions, the pain, the recovery. Most people prefer not to, but it's your choice." He was calling my bluff. He thought I'd back down. I didn't. "Standard anesthesia," I said. "I want to remember." "All right then," he said. "Let's get you prepped." They took me back to a pre-op room, had me change into a gown, started an IV. A nurse came in with a syringe. "This is just a mild sedative," she said, "to help you relax before the procedure." "What's in it?" I asked. She checked the label. "Midazolam, standard pre-op medication." "That causes amnesia," I said. "Some short-term memory effects, yes. But you'll be awake and able to communicate." "I don't want it," I said. The nurse looked uncertain. "It's standard protocol." "I'm refusing it," I said. "I want to be fully conscious and able to remember." She left to consult with Dr. Kowalski. He came back looking annoyed. "Ms. Garrett, I strongly recommend the pre-op sedation. The procedure will be uncomfortable without it. I'll manage, I said. This is highly irregular. So is erasing 5 weeks of someone's memory, I said. He stared at me. Then he nodded to the nurse. Fine. No sedation. Let's proceed. They wheeled me to the operating room. I was fully awake, fully aware. The bright lights, the cold air, the sound of instruments being arranged on metal trays. Kowalski stood over me. Last chance to change your mind. I want to remember, I said. All right then, he said. Let's begin. He picked up a syringe. Local anesthetic, you'll feel a pinch. The needle went into my abdomen. Sharp sting, then numbness spreading. He made the incision. I couldn't feel it, but I could see him working. Small, precise movements. We're collecting adipose tissue, he narrated like he was teaching medical students. Subcutaneous fat, excellent for stem cell research. Very lucrative market. He was doing this on purpose, trying to upset me, trying to make me regret staying conscious. I watched anyway. He collected the tissue, placed it in a sterile container, moved to a different site. Skin biopsy now, he said. Full thickness sample. Good for cellular regeneration studies. Another incision. More tissue removed. I felt sick, but I didn't look away. You know what's interesting? He said, still working. Most people who participate in these studies never know what we're really doing. The memory suppression protocol is remarkable. You can tell someone exactly what you're going to do, have them sign all the forms, and then they forget everything. It's perfect informed consent, technically. They agreed, they just don't remember agreeing. That's not consent, I said. Sure it is, he said. They signed the paperwork, everything's legal. And they get paid for tissue they weren't using anyway. Everyone wins. Except the people you're harvesting. Harvesting is such an ugly word, he said. We prefer collection. And you're not being harmed. All minimally invasive procedures. You'll heal completely. Until you need more samples, I said. He looked at me then, really looked at me. This is the final procedure in your contract, he said. After today, you're done. Unless what? Unless you'd like to enroll in the extended study protocol, same compensation structure, same memory suppression benefits. We could use someone with your tissue quality for long-term research. I stared at him. You want me to sign up for more of this? Think about it, he said. You've made almost $4,000 in 6 weeks. Imagine what you could make in a year. And you won't remember any of it. No pain, no trauma, just money appearing in your account. You're insane, I said. He shrugged. I'm a researcher. I've found a way to conduct necessary medical research while compensating donors fairly and minimizing their discomfort. It's actually quite ethical if you think about it. You're erasing people's memories so they can't say no. They already said yes, he said. The memory suppression just makes it easier. He finished the procedure, closed the incisions, bandaged everything neatly. All done, he said. You'll be sore for a few days, but nothing serious. And congratulations, you've completed the study. Your final compensation will be deposited within 48 hours. They wheeled me to recovery. I lay there, fully conscious, remembering everything. The nurse came to check on me. "How are you feeling?" "Like I've been harvested," I said. She didn't react, just checked my vitals and left. I was discharged an hour later. Walked out to my car on my own. No memory suppression, no fog. I remembered everything. And that was worse somehow. I'm writing this 3 months later. The final compensation was deposited like Dr. Kowalski promised. $575 for the skin and adipose tissue. Total study compensation, $4,497. I haven't spent any of it. The incisions healed. The scars are barely visible now, just like he said. But sometimes I wake up in the middle of the night and I can't remember what I did the day before or the week before. And I panic, wondering if I've been back to Cleveland Surgical Associates without knowing it. I check my bank account obsessively, looking for unexplained deposits. I check my body for new scars. I keep detailed journals now, writing down everything I do each day. Proof that I was conscious, that I remember. Because the worst part isn't what they did to me, it's knowing that if they did it again, I might not even know. The insurance denials keep coming, one every few weeks. Different procedures, different dates, all denied for lack of prior. I dispute every single one. But I'm starting to wonder if they're real. If somewhere in some operating room, pieces of me are still being collected and I just don't remember. Last week, I got a letter from Cleveland Surgical Associates. "We hope you'll consider participating in our new extended research protocol. Excellent compensation rates for qualified participants. All procedures performed with our advanced memory comfort protocol. You won't remember a thing." There was a consent form attached. I haven't signed it, but it's sitting on my kitchen counter, and sometimes I find myself reading it, looking at the compensation structure, thinking about how much I could make, thinking about how I wouldn't have to remember. That's the real horror of it, I think. They've made it easy. They've made it painless. They've made it so you can sell yourself piece by piece and never even know it's happening. All you have to do is sign, just one signature. On page 7. I keep telling myself I won't. But the form is still there, and I can't quite bring myself to throw it away. Because part of me, a small, quiet part that I don't like to acknowledge, keeps thinking about what Dr. Kowalski said. We only bill for services rendered to the body on file, and my body is on file now, in their system, in their database.